Hi, this is Amanda Loggins with my assignment for Psychopharmacology Class 610 for Module 7. Alright, marijuana is a plant-based product that has origins going back over 5,000 years. The first medical evidence of marijuana use dates back to 2900 BC, as cited in ancient Chinese medicine by Chinese Emperor Fuxi. Throughout the years, medical cannabis use was discovered in Egypt, India, the Middle East, Greece, Italy, ultimately making it to the United States with the Jamestown settlers during the 1600s. During the 1800s, cannabis use for medical issues became the mainstream drug of choice due to the number of symptoms that it was capable of aiding. During the 19th and early 20th centuries, marijuana was widely used as medicine, leading to it being noted in the United States Pharmacopoeia in 1850. The Marijuana Tax Act was passed in 1937, placing federal stipulations on the use and sale of marijuana. Due to the passing of the act, marijuana was removed from the United States Pharmacopoeia in 1942. During the early 1950s, the penalties for use and sale of marijuana were becoming stricter due to the passage of the Boggs and Narcotic Control Acts in 1951 and 1956, respectively. In 1970, the United States saw a prohibition of marijuana take effect. The Compassionate Use Act was enacted in 1996, which approved the use of medical cannabis in the state of California. With the legalization of medical marijuana in California, other states were able to follow suit in the coming years. Alaska, Oregon, Washington, and Maine became the next states to legalize medical marijuana in the 1990s. By 2010, there were 15 states who had approved the use of medical marijuana. The largest push for states to gain access to medical marijuana has occurred in the last decade. Currently, there are 10 states and Washington, D.C. that have fully legalized the use of cannabis, including recreational use, whereas there are 33 states that have legalized the use of cannabis for medical use only. There are a number of uses for medical marijuana, including the treatment for cancer patients undergoing chemotherapy. Many patients who undergo chemotherapy have an issue with losing their appetite due to nausea, which likely leads to vomiting. Studies have shown that marijuana helps lessen these issues and allows the patient to feel well enough to eat so they don't end up losing weight and becoming more frail because of the chemotherapy treatment. Neuropathic pain is another side effect of some cancers and creates a great deal of pain for the patient. Marijuana use has been proven helpful through studies to aid in and lessen pain levels for cancer patients. When a patient is going through cancer treatment, they need to be able to get some relief from what's going on inside their bodies, which marijuana is able to help with. Currently, there are 2 marijuana compounds that are chemically pure and have been approved by the U.S. Food and Drug Administration for medical use in the United States. Dronabinol, also known as Marinol, and Nabilone, also known as Cement. Both of these drugs are being used to treat nausea and vomiting caused by chemotherapy when other drugs have not worked for the patient. Scientists have made headway in studies in the labs and have reported that marijuana can lessen the growth of cancer cells and in some situations even cause the cancer cell to die completely. At this time, marijuana has been reported to be safe in medical treatment. However, it has not been completely proven to help control cancer or cure it. There is still much research that needs to be done in this area, but steps are being made for marijuana to play a role in aiding patients who are battling cancer. There are a number of pros and cons when it comes to the discussion of legalizing marijuana in the United States. Individuals who use marijuana do open themselves up to possible issues involved with taking the drug, not unlike any other medication. Users of marijuana will feel the effect of euphoria. It can also lower one's ability to control their movements. It can cause disorientation, and sometimes it can cause unpleasant thoughts and heightened anxiety. Smoking marijuana leads to more risks because it acts in the same way as smoking tobacco and delivers substances through the smoke to one's surrounding and affects people who were nearby. The smoke that is inhaled has a similar effect on the lungs to smoking regular tobacco. Many strains of marijuana that are being used for medical use are CBD dominant, meaning that the majority of the THC is removed from the plant, thus taking away the high side effect of marijuana. This allows patients to continue on with their daily life while being able to benefit from the positive side effects of marijuana. There are a number of medical issues that medical marijuana can aid with. Marijuana helps with nerve pain, nausea, weight loss, pain management, and it also acts as a muscle relaxer. It also aids patients who suffer from HIV, PTSD, IBS, Crohn's disease, along with a number of other health issues that impact one's quality of life. The major draw to medical marijuana is that it's clearly much safer for patients to use than the alternative, which is opiates. A study that was conducted in 2014 accounted for a 24.8% decrease in death from opiates because marijuana was an option to treat people's medical ailments. Researchers had kept their eyes on the states that had legalized medical marijuana to discover that every state had lowered rates of opiate overdoses. I am wholeheartedly in agreement that marijuana should be legalized at a federal level for medical use. There's been much research that proves that marijuana is helpful in a number of medical situations. I, for one, would much rather use a natural plant to fight against medical issues than some chemical a pharmaceutical company concocted. As I'm growing older, I want to treat my body better and use more natural and holistic ways of managing the many medical issues that I have. If there's a plant out there, such as marijuana, that will subdue some of the medical issues I'm having, I am all for it. I'm on a number of medications that have their own side effects. One of my medications is for nerve pain, but I'm also faced with a number of side effects such as drowsiness, fatigue, and weight gain. I take this medication 3 times a day. I don't know what it's like to not be tired or want to curl up and take a nap. I have to force myself to function because I have to carry on with daily life and I can't sleep my entire life away. I have talked to other individuals who live in states where medical marijuana is already approved, and I'm in awe of some of their stories in regards to how much it's helped them. I had a discussion with my doctor, and he's going to sign off for me to get a medical card, and our dispensaries open in April. I'm highly looking forward to seeing how medical marijuana will help with the number of medical issues that I'm facing for the rest of my life.